Changes in medicine, 1848 to 1948 century. Why medicine not made progress by 1948? The medical knowledge of Britain. At the beginning of the 19th century, medical knowledge in Britain was still in its early stages, and many diseases were poorly understood. There were significant gaps in knowledge and many treatments were ineffective or even harmful. Anatomy. There was a good understanding of human anatomy, but this was largely limited to what could be seen and felt during dissections. There were still many mysteries about how the body worked. Surgery. Surgery was very risky, with high mortality rates due to the lack of effective anesthesia and antiseptic techniques. Amputations were common, and many people died from infections after surgery. Infectious diseases. The causes of infectious diseases were not yet understood, and many people died from diseases such as cholera, typhus, and smallpox. Vaccines were not yet available. Mental health. Mental illness was poorly understood, and people with mental health problems were often institutionalized or subjected to cruel treatment. Pharmacology. There were limited drugs available, and many treatments were based on herbal remedies that had a little scientific basis. Britain's beliefs on illnesses. Four humors and the theory of opposites. At the beginning of the 19th century, many Britons believed that illnesses were caused by imbalances in the body's humors. This belief had been inherited from the ancient Greeks and Romans, and it held that the body had four humors: blood, phlegm, yellow bile, and black bile, which needed to be in balance for good health. Illness was believed to occur when one or more of these humors was out of balance, which is also called as the theory of opposites. The theory of opposites is an ancient medical theory that dates back to the time of Hippocrates, a Greek physician who lived in the 5th century BCE. According to this theory, diseases are caused by imbalances or excesses of certain bodily substances or humors. The theory of opposites states that in order to treat an illness, one must administer substances that have the opposite qualities of the imbalanced or excess substance. For example, a fever was thought to be caused by an excess of blood, and a cold was believed to be caused by an excess of phlegm. The treatment for an illness was aimed at restoring the balance of the humors, usually by administering substances that were thought to have opposing qualities. For example, a fever might be treated with a cold compress or a purgative to reduce the amount of blood in the body. Or in other words, if a person has a fever, it was believed that they had an excess of the humor blood, which was thought to be hot and moist. To treat this, a substance with the opposite qualities, such as a cold and dry substance, would be administered. This might include applying a cold compress or taking a purgative to reduce the amount of blood in the body. This theory of humors was not based on scientific evidence, and many treatments were ineffective or even harmful. It wasn't until later in the 19th century that new scientific theories and discoveries led to a better understanding of the causes of diseases and more effective treatments. Miasma. Miasma is another belief that was used in ancient and medieval medicine to describe a noxious or poisonous atmosphere that was believed to cause disease. The concept of miasma was based on the belief that disease was caused by bad or polluted air, water, or soil. In the 19th century, miasma theory was revived as a possible explanation for the spread of diseases such as cholera and malaria. The theory held that diseases were caused by bad air or foul-smelling gases that were produced by decaying organic matter, such as sewage or rotting garbage. These noxious vapors were believed to spread disease by entering the body through the lungs or skin. Spontaneous generation. Spontaneous generation is a now discredited scientific theory that held that living organisms could arise spontaneously from non-living matter. The theory was widely accepted in ancient times, and it was believed that animals such as mice or flies could arise spontaneously from food or other organic matter. There were several factors that contributed to the slow progress of medicine in Britain by 1948. Limited understanding of diseases and their causes. The understanding of diseases and their causes was still limited in the early 20th century, and this made it difficult to develop effective treatments. Many diseases were thought to be caused by miasma or other environmental factors, rather than by specific pathogens or underlying physiological mechanisms. This limited understanding of disease had a significant impact on the practice of medicine and surgery at the time. Without a clear understanding of the causes of many diseases, physicians and surgeons were often forced to rely on trial and error to develop treatments. Limited funding. This lack of funding made it difficult for physicians and researchers to conduct studies or develop new treatments. Many hospitals and clinics at the time were poorly equipped and understaffed, and patients often had limited access to healthcare services. This lack of resources made it difficult for physicians to provide the best possible care to their patients, and it also hindered the development of new medical technologies and treatments. Limited technology. Medical technology was limited, and many procedures and treatments relied on simple tools and techniques. For example, surgical procedures were performed using basic instruments such as scalpels, forceps, and saws, and without the benefit of modern medical imaging or diagnostic technologies. This limited technology had a significant impact on the practice of medicine and healthcare at the time. It made it more difficult for physicians and surgeons to accurately diagnose and treat many conditions, and it also made many medical procedures more difficult and riskier. World War II. The Second World War had a significant impact on medical research and development in Britain, as many resources were diverted to the war effort. During the war, many scientists and researchers were recruited to work on military projects, such as developing new weapons and technologies, which left limited resources for medical research. Additionally, the war caused major disruptions to the healthcare system, as many hospitals and clinics were damaged or destroyed, and medical personnel was often called away to serve in the military. The war also led to shortages of medical supplies and equipment, which made it difficult for healthcare providers to provide adequate care to their patients. Limited access to healthcare. In 1848, access to healthcare was limited, particularly for those who were poor or marginalized. Healthcare was not yet a universal right, and many people could not afford to pay for medical care, which was often provided by private physicians or charitable organizations. Hospitals were often overcrowded and understaffed, with poor sanitation and limited resources. Many people were unable to access healthcare at all, and those who did often received inadequate or ineffective treatments. This lack of access to healthcare had a significant impact on public health, with high rates of illness and mortality in many communities. In particular, infectious diseases such as cholera and tuberculosis were widespread and deadly, and there were few effective treatments available.